Did you know that one definition of depression is anger turned inward? And if that's the case, if depression is anger turned inward, well, then how do we work with it? How do we heal from it? My name is Caroline Garnett McGraw with The Clearing, and today that is what we're going to talk about. We're going to dive into the true nature of depression, and we're going to talk about your treatment options if that's what you're dealing with today. So just to give a tiny bit of background, The Clearing is a non-12-step residential dual diagnosis addiction treatment center located on the beautiful San Juan Island in Washington State. And we like to tell our graduates, well, I should say, we like to have our graduates share with others their definition of the work that we do, which is we help people to stop hating themselves. And that's what I want to bring to you today, to talk about solutions to how to work with depression, how to stop turning your anger inward against yourself. That is really important work. And that's what we're going to dive into today. I have 3 pages of notes. I'm going to talk fast like a Gilmore Girl, and we're going to give you some great options if this is what you're struggling with right now. So first, I want to talk about that definition of depression as anger turned inward. So there are certainly biochemical components to depression. We all know that. Research shows that the receptors in our brain are affected, the chemicals in our brain are affected by our depression, and there's certainly a biological component. There's no questioning that. However, what we see really often in treatment is that people only address depression on 1 or 2 levels. So they'll address the physical level with medications or with exercise or even with brain stimulation techniques. And then they'll address the mental level by doing some thought work, maybe some cognitive behavioral therapy. But a lot of times there's a neglect of the emotional and spiritual components of depression. There's a lack of exploration into, all right, if depression is anger turned inward, well, how do I work with my anger? How do I heal from that? That's an emotional level issue. That's not something that you can resolve just by working on the physical or mental levels. You need to dive into that emotional level work as well. So that is the biggest truth that I want to share with you here just to start, that whatever treatment option you choose to deal with your depression and to start to heal it, you need to choose a provider, a support setup that helps you to address your depression on all 4 levels of self. Don't just settle for physical level interventions, although they can be very helpful. They're part of the solution, but they're not the entire solution. So that's the first takeaway. Human beings have 4 levels of self: physical, mental, emotional, and spiritual. So to work with your depression and to heal it, you need a program that addresses all 4 levels. Another important takeaway here is that when we're working with anger, depression is anger turned inward, what underlies anger is hurt. That may be a light bulb moment for you, so I'll say it again. Underlying every feeling of anger, there's a hurt that is present. And so one really important way to work with your anger is to learn to work with those underlying hurts. And a core principle of spiritual psychology, which is the approach we use at The Clearing, is that when we apply love to the parts of ourselves that hurt, that's when we heal. So when we're able to offer love and compassion to those hurting parts, we not only heal our depression, but we also resolve the anger. So that's to get us started. That's the big picture here. Now I want to talk a bit more specifics. So as I mentioned, medications and physical level supports for depression are really important, and we don't want to downplay that. We are a medication-friendly program, which, if you don't know what that means that when you come to us, we do not do as some other programs do and say, you have to come off all your medications and we're going to establish your new baseline and all of this. No, we want to work with you where you're at, and we want to proceed with caution and a lot of respect. So again, medications are helpful. They can be really life-saving in a crisis. But if you only rely on medication to treat your depression and you never do the mental and emotional level work to get to the root of it, then you're going to stay stuck. And the thing that we know now is that a lot of medications for depression actually stop working after a certain period. And there are various reasons for this. Your physical condition can change. If you develop another health condition, it can affect how your antidepressants work. And there's also a level on which the receptors in your brain acclimate to the drug, and so it stops being as effective for you. So my point in sharing that with you is to realize that if your antidepressant is working now and it's helping you now, that's great, but it's not a long-term solution because it might not work in the same way forever. So we need to do that mental and emotional level work to really get to the root cause of the issue. So let's dive into treatment options. There is no one fit for everyone. Everyone is different, but the best option for you really depends on the severity of your depression and the stage that you're in with it and how much support that you need. So, quick disclaimer here for everything I'm saying. This is not a substitute for medical advice. I'm not a doctor. I'm not giving you medical advice. So, we're going to share from our experience as a treatment provider, but this should not be a substitute for your own doctor, your own provider, your own medical advice. Okay, now we're covered on a liability perspective. And the first treatment option that many people pursue for depression is outpatient counseling or therapy. And that can be a really great start. Often, if people can't afford or can't access therapy individually, they may start with a group program. Again, that can be wonderful. But I will say, if you're dealing with a mental health issue that's as serious as depression, it's really important to be working with a mental health professional. So to emphasize that, layperson-led groups are great. They can be really helpful, but they're not a substitute for professional mental health treatment. And depression, untreated, can be life-threatening. It's very serious. So we don't want to take this lightly. So when you are working with a therapist, make sure that they're using evidence-based psychological techniques to help you to heal from depression. Some of the approaches that you might use are cognitive behavioral therapy, rational emotive therapy, Gestalt psychology. These are just a couple that we use in our program. And I will include a link in the comments to the full list of counseling strategies that we use in our program. But the reason that I emphasize this is because it's really important to use an approach that actually has been proven effective for depression. Just talking about your struggles without actually using a proven therapeutic approach might not move the needle on your depression. So don't be afraid to ask your therapist what approach you're going to use. What type of therapy are we going to be doing? And to look up, is that a proven therapy that has helped other people with depression? So sounds basic, but a lot of people, especially if you're struggling with depression, it's all you can do to just get yourself to the therapist's office. So I am advocating that you or someone you love take that additional step and make sure that they're actually providing therapy that has been proven to help with treating depression. So at the same time that you're seeing a therapist, you may also be seeing a psychiatrist to help you with your medications and to stabilize you there. And I will again emphasize that just taking medication and just working on the physical level is not going to get you all the way that you want to go. And most psychiatrists, not all, but most, are not going to be able to give you the type of individualized counseling and personal support that you really need to work on the mental and emotional issues. You will probably need to go and see a separate therapist in order to do that. So I will also say there are other physical level interventions that people try that are not just medication. So you might do light therapy for seasonal affective disorder and depression. You might do some brain stimulation therapies. Those are newer. There's not as much research on them, but those are other physical level interventions that people use as treatment for depression. And I will also mention that exercise has been proven to be particularly effective with mild depression. So that is an intervention where research has shown its efficacy. And another important intervention is sleep. Sleep is key. When you are sleep deprived, everything seems harder and much worse. That is true for anyone, whether or not they have clinical depression. So just putting those out there. They may sound basic, but you'd be surprised how many people don't address these levels and go straight into medication without working on, wait, I'm only sleeping 4 hours a night. Maybe we need to address that first. So I will also say that stress reduction is huge. If you're able to outsource some of your tasks, get help with childcare, get help with housework, that can also be tremendously helpful, especially if you're in crisis. So, all of that being said, that's more what to do if you're dealing with mild or more situational depression. But what do you do if you have tried all of that, you have been down that road before, and it hasn't helped you to heal fully? What do you do next? You're going to your outpatient therapist maybe once a week, maybe twice a week, maybe a couple times a month, and it's just not moving the needle. It's not getting you where you need to go. What are your other options? That's what I'm going to talk about now. So there are some intensive outpatient and day treatment programs for depression. So what this typically looks like is you go into either a hospital or a provider's office for a block of time each day, and you receive more intensive therapy, and it's just more time in therapy. And then you go home, or you might go to work, depending on the level of intensity of this program. But typically you'll just go to the program and then go home. That this is your job, but you're living out of the program. They're not available everywhere, but they do exist. And they are a good option if you have done individual therapy, but you know you need something more and you need to try this. So that said, until recently, one of the only options to get help for severe depression was, to put it really bluntly, to do something drastic enough that you ended up in the hospital. For example, a suicide attempt, self-harm attempt, or to check yourself into a psychiatric ward. And I will read this. This is from the Mayo Clinic's page on depression to share a little bit about what that looks like. In some people, depression is so severe that a hospital stay is needed. This may be necessary if you cannot care for yourself or if you're in an immediate danger of harming yourself or someone else. Psychiatric treatment at a hospital can help you keep calm and safe until your mood stabilizes. So this can save a life, and this is not to be taken lightly. I know that there is a stigma surrounding mental health care that we're trying to fight as a culture, and it has lessened considerably. But we talk to a lot of people who are very reluctant to get this level of support because of the stigma. What would this look like to those around me? But as we wrote in our blog post on suicide prevention, when you are in deep crisis, the most caring thing to do is to make use of emergency services. So if you are a danger to yourself, being in a psychiatric ward and having a 72-hour hold for your own protection, that might sound scary, but it's a lot less scary than the alternative. It's a lot less scary than doing something that you can't undo. So just putting that out there, if you or someone you love is in crisis right now, call 911, call the National Suicide Hotline at 800-273-8255 immediately. Once again, 800-273-8255. That is if you or a loved one are in crisis. So hospitals can and do save lives. And if you are in a severe crisis, that may be the very best place for you to be. But what do you do if that's not a fit for you? So maybe you're relatively stable. Maybe you've been to the hospital, but you're still deeply depressed and you don't feel ready at all to return to your regular life. You might get referred to a day treatment program, but that might not be an option for you. And even if it is an option, that might not be enough. That might not be the amount of support that you need. So that's why there are more residential treatment centers for depression that are spraying up to meet this need, because you are not alone in this. A lot of other people are finding themselves in this gap between, I can't stay in the hospital either because my insurance has run out or they've, I need to leave, I need to move forward. But outpatient treatment is not providing me the support that I need. So that's actually part of what we do at The Clearing. We help to bridge that gap. So we work with people whose depression is serious, it's impacting their daily life to a significant degree, and they need more than 1 hour a week of therapy. They just need more support than that. And so we do primarily work with people who have dual diagnosis. So that means a mental health condition such as depression or anxiety, in addition to a substance abuse issue. But we also work with people who only have the one diagnosis of a mental health condition. They just have the deep depression. They just have the crippling anxiety. We also welcome participants who are in that boat, because the primary gist of what we do with people with dual diagnosis is very similar to what we would do with someone who just has the deep depression, which is we work with the underlying mental and emotional issues that have gone untreated. We work with the underlying issues that are causing the substance addiction, if that's what you have. So I will post a link to more about that and our services in the comments as well. I do want to say too that if you have this hesitance of, well, I don't want to get inpatient treatment for depression because I don't have a substance abuse issue, then you're blocking yourself from a source of really positive support, because what you're looking for is the mental health treatment. And if you get that as part of an addiction recovery program, then that's great, because the key is you need more professional counseling hours. You need more time to work through these mental and emotional issues. And usually the place that you're going to find that in an inpatient setting tends to be an addiction treatment facility as well. So just putting that out there, that even if you don't have an addiction, it's actually increasingly common for people who just have this serious mental health concern, who just have depression, to do an inpatient treatment program. So also we'll say, make sure before you enroll in a program to really be rigorous about checking out how much professional counseling they do provide, because some programs sadly will only provide the state mandated minimum number of hours per week. And so this varies state to state, but depending on where you live or where you're going, that could be as little as 2 or 3 hours of counseling a week in an inpatient program. And obviously you would do a lot better just going to your outpatient treatment or just scheduling multiple appointments with a therapist. So I would caution you, do not pursue a program that does not have a significant number of professional counseling hours, because that's what's going to make the difference when it actually comes to healing from your depression. So in our program, for every participant, they get at least 120 hours of professional counseling, both individual and group therapy sessions that are led by professionals. So that's just an example. We go way above and beyond our state mandated minimum. And that's why we have an over 80% success rate of graduates who are healing and who are in recovery after doing our program. So we help you to create the life you want. And the way that we do that is by diving into those underlying core issues, by taking care of the part of you that is hurt and is angry, and that's manifesting itself in your depression. The depression's not going to heal unless you work with what's below it, which is that hurt and that anger or that trauma, loss, grief, despair, whatever it is that you haven't addressed that is fueling that depression. And I will say too, often this starts very early in life. We have participants who can remember being 5 years old, 6 years old, and already showing symptoms of depression because they were already in a situation where they were hurting. They had anger, but there was no way to express it. There was no safe place for them, and they started turning it inward. So what I would say, if that's you, you're not broken, you're not irreparably damaged, you can heal. It is possible to heal from depression. It's just that you've been in an environment, or you were in an environment where it wasn't safe to heal and you didn't have the tools. You didn't have the knowledge of how to do it. So the example that I like to use is that healing an emotional level wound. It's kind of akin to when you go into surgery, right? You wouldn't have just anybody performing surgery on you. You would go into a sterile operating room with professional surgeons who knew the procedure to help your body to heal. And emotional level wounds in many ways are similar in that when we're first learning how to tend to them, we need to be in a very safe space with professionals who know how to tend to emotional level wounds. And once we learn that process, once we are empowered to understand how we can heal our own emotional level wounds, then we can go out and leave the metaphorical hospital or the literal inpatient treatment program and we can go out into the world and we can take care of ourselves. But for that initial learning, it is so important to be in a safe and supportive space with people who know this work and who can be trusted with those vulnerable parts of yourself that you need to learn how to heal. So that's what I would share with you today. I'm going to check my notes and make sure I didn't miss anything. We welcome your questions. We welcome your comments. I'm going to post those links in the video. And also just want to open the door. If you or someone you love needs to talk about your treatment options for depression, we're happy to help. You can give us a call at 425-275-8600. Once again, that number is 425-275-8600. Calls are confidential. We're happy to help. Thank you so much for watching and for listening. Signing off.